This presentation is an introduction of the new and improved features available with TScan software version 6.0. New and enhanced features are based on feedback from TScan users, making analyzing occlusal data even more convenient and user-friendly. We have polished the user interface to make it more appealing. See the difference from version 5.2 to the new 6.0 software. The arch outline is much smoother and the buccal, lingual, and two center lines have greater visibility. The software is now customizable so that you can set your user preferences and select the options or icons you wish to see in the program. You can set the user preferences by going to Options on the toolbar and select User Preferences. You can then select which part of the software you wish to customize. You can click on the Toolbar tab and select and unselect the icons you wish to appear in each window or on the toolbar. We have added tooth numbering systems for our international customers, now available for Universal, ISO, UK, and Scandinavian. 3 standard view modes, Single, Multi, and Grid, provide you with a full array of options. You can select Single mode for viewing one movie at a time with different options within that mode. View only the 2D and graph windows, or only the 2D, 3D, and graph. Multi-mode is set up in a similar way but allows you to open more than one movie at a time with different viewing options under this set. Grid mode is an excellent mode for comparing data. It works similar with different options but sets the screen to view rows and columns for greater flexibility. After taking a recording, the software will automatically place the A, B, C, and D lines for the determination of occlusion time and disclusion time. This will save time trying to analyze and manipulate the graph. New to version 6.0 is the ability to see the time differentials for occlusion and disclusion time automatically with the click of a button. The occlusion and disclusion tables list the measured values of occlusion time and disclusion time from the selected movies in an organized manner. This tool shows the progressive improvement pre, mid, and post-treatment for documentation purposes. There have been many enhancements to the graph and zoom graph in version 6.0. The zoom graph now functions like a regular graph. For example, the A and B lines can now be moved. Color coding of the graphs have added tremendous value for determining where the patient occludes, shown in blue, holds his or her teeth together, in green, and performs an excursive movement, orange. The line segments before OT and DT numbers in the key graph now coincide with the graph, time axis, and the center of force trajectory line. There are now keyboard shortcuts available for ease of use. You can now snap the timeline to the A, B, C, and D lines by hitting the corresponding keys on the keyboard. To move the A, B, C, and D lines to the moment in the time you are in the movie, hit Control and the corresponding keyboard letters. The help file of version 6.0 TScan software is now equipped with an image library. The image library includes relevant pictures of equipment, muscles, diagrams, tomograms, MRIs, and anatomy. This new feature can be used as a patient education tool that can help explain issues related to the condition being treated.